My name's Michelle James. I am from California, Northern California, educated almost completely in California. I started out in private practice for a couple of years, working with my father, who was an orthopedic surgeon, in his private practice group, and we all volunteered at Shriners Hospital, which was in San Francisco then. And everybody in the group spent a day a week there. And both my dad and I found that that was our best day of the week. And so when the Shriners organization decided to hire full-time surgeons instead of relying on volunteers, we both signed up, and we were 2/3 of the surgical team for many years. And then after he retired, I continued, and I ended up spending 34 years at Shriners on the faculties of both UCSF and UC Davis, which was a really nice complement. Well, at the time I joined ASSH, it was, and still is, just an absolute privilege to be part of an organization that prior to joining, you need to show that you are well-trained and that you know how to take good care of patients, that you are board certified and subspecialty certified, along those lines. That was really meaningful to me. It also was where my closest friends from training, where I could see them every year. And then friends that I made along the way, colleagues and friends along the way. And then it turned out to be a venue for me as I became more academic to present and to educate around my little tiny subspecialty. The changes over the years in the ASSH are really noticeable to those of us who joined in the 90s, or who started in the 90s. Along with Amy Ladd and Mary Beth Izaki, a couple others, we joke that the meeting of the women in the Hand Society could be held in the women's bathroom. And there were plenty of sinks because there were so few of us. There were few female mentors at that time. And now there's a line for the women's bathroom. So that's an index of the change. That's a very noticeable difference, and it is wonderful. I had sort of unusual mentoring very early on, starting in high school, from one of the few women in orthopedic surgery at that time, and I was connected to her through my dad, which I didn't know at the time, but later he revealed. And she very convincingly, her name was Lorraine Day, and she convincingly talked me out of nursing and into medicine when I was getting ready to go to college. And then when I was choosing a specialty, she very convincingly talked me out of OBGYN and into orthopedic surgery. She was a very convincing person. Moving forward after that, one of my true mentors in hand surgery and life is Dr. Relton McCarroll. And I met him at Shriners when I started there. He was working a day a month. And actually I met him in my residency before that. I rotated with him. And he helped me just fall in love with anatomy of the hand and hand surgery. And his office was a literal descendant of Sterling Bunnell's. I mean, Bunnell had been the original partner in his office. That was very cool, because for some of the research we could do, we could go back and look at Dr. Bunnell's original charts, and he was an artist, like Dr. Reardon, and you could see in the charts his drawings of kids with congenital malformations, and that was really, that really stuck in my memory, just to see the history of that. My other mentors along the way, one of them was really through Dr. McCarroll, and that was his co-resident, Paul Mansky, who was the editor of the Journal of Hand Surgery and who got me interested in editing and got started on, something I did throughout my career for Journal of Hand Surgery and then Journal of Bone and Joint Surgery. I think one of the challenges has always been scarring and scar management, and I treated kids with burns where that was really a huge issue. I didn't mention when I talked about outside advancements, but there's some really exciting work being done, some of it at Stanford, that is kind of maybe changing the whole way that we think about scars. and how scars can, how we can keep from causing scars that are problems, and how we can identify potentially people who are going to have problems with their scars. I think, as we talked about, the increase of women in our specialty. I think in orthopedics in general, we have valued career paths that men have been able to achieve with incredible support from their partners, and those may not be the paths that women are able to achieve while they're doing some of the things that we choose to do outside of hand surgery, such as reproduce, and actually spend time with our children. And it's hard to do both, and the need to move forward with having kids coincides with the time when your career is taking off. And that's an unsolved issue, but I think there is more acceptance in our specialty that there's different paths. But I think there's just, in the generation coming up and the residents and fellows that I get to know now, I think there's more of an acceptance that that's part of life. The advice that I give to my residents and fellows is that your career is long. You're looking at 30 to 35 years, and when you commit, like say you accept a job out of training, you're not making a 35-year commitment. And it's not just that you change your job, but you can find there's a lot of different opportunities within our specialty. You can serve your professional society, obviously, serve on committees or serve in leadership in your professional society. You can serve in board certification. You can do research, clinical research or otherwise. You can focus on providing the very best care that you can provide of your patients. There's a lot of different options.